This podcast is for informational purposes only and is not intended to replace professional medical advice or be a substitute for therapy. Please contact a mental health professional as needed. If you are in need of urgent or emergency health care, please contact your medical and/or mental health provider, call 911, or go to your nearest emergency room. The information presented in this podcast does not reflect the opinions of those with whom Dr. Ellick might be affiliated as an employee, consultant, or colleague, past or present. Hello, and welcome to another episode of From Mayhem to Mindset with Dr. Laura. I am your host, Dr. Laura Ellick, and here I am with a gentleman who really needs no introduction, especially if you live in South Florida. However, I'm going to go ahead and do an introduction anyway. So thank you, Mark, for being here.
Thank you for having me.
This is just amazing. This is Mark Astor, guys. Attorney Mark Astor, born and raised in the United Kingdom until the age of 21. Mark has been an attorney since 1994. Before entering private practice, Mark began his legal career as a Palm Beach County Assistant State Attorney, a position he held until 1999. During his career as a government lawyer, Mark served as chief of 2 different county court divisions and thereafter was promoted to a felony trial division. He has handled thousands of cases ranging from first-degree misdemeanors to capital murder. In February 2016, Mark formed Drug and Alcohol Attorneys, a concierge service dedicated to help families and individuals suffering from substance use and mental health disorders. Together with his experienced team and using the tools and resources only available to an experienced practitioner, Mark has been witness to many individuals experiencing the miracle of recovery. In 2020, not long after the COVID-19 pandemic began, Mark noticed a disturbing trend of individuals who were relapsing, suffering from anxiety and depression, and calling for help. Shortly thereafter, Mark formed Baker Act Attorneys. Many of these individuals found themselves being involuntarily committed by the state and held against their will under the Baker Act. Now, in the care, custody, and control of the state, these individuals were being abused, mistreated, forced to take medications, and unable to secure their release. Mark discovered that many hospitals and Baker Act facilities only cared about making money, not helping people. Prior to forming Baker Act Attorneys, facilities were free to violate rights and the Baker Act statute itself because no one was watching. That changed in 2020. Mark has successfully litigated against many hospitals and facilities and is now feared in that community. I believe we can get everyone out of a hospital or facility provided the family doesn't delay calling us. I'll drop everything day or night to help an individual being held unlawfully. When he's not working in his law practice, Mark empowers members of the community by teaching Krav Maga. Woo! Oh my God. Which is, if people don't know, it's the Israeli system of hand-to-hand taught to the military special forces and anti-terror units. So you really don't want to mess with Mark. He also enjoys an early morning workout, believing that a healthy body leads to a healthy mind. Welcome, Mark. And we can say that you absolutely stand by everything that you talk about because you just did a workout on your way over here, didn't you?
I did. I was still sweating as I walked in the door, but I'm so glad I'm here. And thank you for having me as a guest. It's so nice to sit here and chat with you.
I am so thrilled to have you here because we connected a long time ago working on several cases. Your name is associated with the mental health industry in South Florida. There's the Baker Act, there's the Marchman Act. People talk about these all the time, but I don't think people really understand what each one actually means. So I have to tell you personally, I'm 50-50. I'm pro-con on both of them. I see a lot of weaknesses for just some of the reasons that you mentioned in your description. But can you discriminate for people the difference between a Baker Act and a Marchman Act?
Yeah, so there's basically 3 statutes that we operate under, Dr. Law. There's the Guardianship Statute, Marchman Act, and then there's a Baker Act. And from a 10,000-foot overview, those 3 statutes work to basically allow some form of involuntary commitment. In other words, taking somebody and placing them in a facility. And it depends what the purpose is and it depends who does it. So the Marchman Act is a statute that's really very unique to Florida. And it allows mom and dad, who's our typical client, to go get a court order to place adult child in a treatment facility where there's a primary substance use disorder for periods of 90 days. And you can, go from 90 days. I mean, I've had somebody under the Marchman Act for 2 years. So you can continue to extend this thing. It also has what I call an ex parte provision, meaning we can ask a court for a court order without a hearing, and if someone's in immediate crisis, literally go grab them and get them to a place of safety before we can get back into court. As a general rule, so I won't confuse everybody, it's typically initiated as a private action. It can be initiated by the state, but there's only one county that I've ever encountered in Florida that actually does it that way. So for all intents and purposes, it's mom and dad, or it could be siblings or spouses going to court, getting a court order where there's a primary substance use disorder. The Baker Act is a statute that allows the state of Florida to take custody of somebody. It's not a treatment statute, although it can be initiated by somebody running to the court to get a court order. But once it's granted or it's initiated, the state now takes that person and they become a ward of the state, albeit on a temporary basis. But it's designed for situations where somebody is in immediate crisis because of a mental health issue, i.e. maybe they're suicidal, something of that nature. It specifically excludes substance use, which is why we have the Marchman Act, traumatic brain injuries, things like autism and things of that nature. So very different statutes, but at the end of the day, they both allow for this involuntary commitment, and that's why they work together. And if they're done right, they're really powerful tools to save somebody. Part of the problem is, though, they're sometimes misunderstood, they're not used correctly, and every county in Florida does things just a little bit differently, and that's their way. And so if you don't understand that, even as lawyers, we get ourselves in a bit of hot water because we can't get the case moving in the right direction. So we've got to be really careful how we use these tools.
So one of the things that I've heard about the Baker Act, first of all, it's a 3-day hold, correct?
Well, okay, so the lawyers, our favorite words for lawyers are "it depends."
It depends.
Because there's two types of Baker Act. There's the involuntary, and then there's voluntary. So involuntary, as you correctly pointed out, is an initial 72-hour detention, but that can get extended anywhere from 0 to 6 months, and I've seen it happen. So you've got that initial detention period, but the problem with that is that nobody knows you're there once you've been detained.
Now, this is a difficulty, according to my knowledge, and please correct me if I'm wrong. So I trained in New York, right? So in New York, if you send somebody to the ER because you have some concerns about them, they will actually get some sort of treatment in the ER. They will be evaluated. If it is deemed that they are not actively suicidal, they will actually get some medication. They will start them on something. They may get a referral to follow up with a provider. Once you are, let's say, remanded to a Baker Act facility, there's no treatment that happens in that 72 hours, correct?
So the way it works is, let's say somebody goes to the hospital, which is not unusual, right? They go they might even show up because they don't feel well. Maybe their meds don't work, or there was some type of medical issue. They go to the hospital. Now, typically the hospital, somebody there, the chief psychiatrist will do some type of assessment. Sometimes it's done on something like an iPad. And if the doctor determines they meet criteria, and I use that word very loosely, and we can get into that in a second, they can then initiate the detention. And that, once the person is medically cleared and ends up in a behavioral health unit, either at that hospital or at a separate facility, the 72 hours starts to tick. So they can administer care there, but typically medications that are designed to treat the mental health crisis don't start until
working right away, right?
Yeah, well, and also they typically don't always give them right away. They want to get them into the behavioral health unit.
So what's the ultimate, in your mind, what's the ultimate goal of doing a Baker Act? Is to get someone contained until you can refer them to the appropriate place? So
the motive is supposed to be assess, stabilize, release. That doesn't always happen. And sometimes what happens is there's confusion about the fact that it's not really designed for treatment. So there's 3 ways you can initiate a Baker Act. Law enforcement initiates it, a qualified professional like you, or somebody goes to the courthouse and files a petition with the judge. And what typically happens is someone runs to court, they file a petition with the judge thinking that they're going to get their loved one into treatment. Right? If the court grants it, there's no hearing, the judge reviews the pleadings, and if the judge grants it, then the police go and grab this person. They take custody of them. Person now becomes a ward of the state, and they take him to a designated licensed Baker Act receiving facility. And that's when the 72 hours starts to tick. But if someone needs treatment, the Baker Act is really not designed for that, because one of two things are going to happen here. Either they're going to be released within the 70-child period. I don't think that helps them at all. Or the facility is going to file a petition to keep them for an extended period of time. I don't think that helps them either, because basically once the person is grabbed by the state, their rights to make decisions regarding their own health care are terminated. The family's rights to make decisions for their loved one are terminated.
That's what I thought. Yeah.
And now you basically have clinicians in a facility making these behavioral health decisions. And a lot of the time, they don't know anything about the person's history. And a lot of the time, if the person has health insurance, they are motivated to try and keep the person because they are getting paid for every pill and injection and group therapy session and whatever else they want to charge for. I mean, not all facilities are like this, but there's a cluster of them, and I see the same facilities over and over and over again. Mm-hmm. And sometimes, someone's running to the courthouse because they want to get their loved one treatment, and they've been told, oh, go file a Baker Act. No, you don't want to do that. I mean, if there's a true emergency, call 911. The police can come take them. If they're suicidal, call 911. That's what it's intended for. We want to be able to grab somebody and if they're in immediate crisis and get them to a place of safety. Mm-hmm. But if you've got time to run to the courthouse, fill out the paperwork, wait for a judge to review it, and then have the police come, I'm wondering how much of an emergency it is, because that's right.
Mm-hmm.
I mean, if it's going to take that long, and it could take the whole day, how much of a crisis can it really be? And I'm not poo-pooing the idea of doing it, but it's just the wrong vehicle to get the job done.
Mm-hmm. So when would a family call you?
Well, typically they call us when we're the last port of call. Mm-hmm. They call us when they've tried everything else. And most of the time we get a call from somebody where there's a loved one in the family, 25 to 45, sometimes even older, and they have been suffering for 5 years, 10 years, 15 years, sometimes even longer. And the family has tried everything. They've tried interventions. They've tried to get their loved one to go. Perhaps the loved one has been in treatment, and maybe they've been in multiple treatment centers, and nothing has seemed to work. Maybe they've even tried going to court with a lawyer or on their own, and that hasn't worked. And they're like, okay, we can't take it anymore because, I mean, it's a family disease. You know that I'm preaching to the choir here.
So this is more for the addiction piece, right?
Well, I will tell you, it's interesting. You mentioned in the bio, drug and alcohol attorneys. When I opened up the practice in February of 16, and I actually started it out of the local library here in Boca because I was flat broke and had no money, but I had an idea and I had a mission and I had a bunch of people I wanted to help. So the reason I called it drug and alcohol attorneys is because it was predominantly alcohol and recreational drugs. Then COVID came along and we legalized marijuana here in Florida, and that completely changed the dynamics of the cases that we were getting. Most of our cases now are primarily driven by mental illness. And if you throw a little legalized marijuana on that, you now have a very volatile, combustible situation. Because from what I'm seeing, and I was a child of the 80s growing up in England, and I saw a lot of my friends smoke marijuana, this stuff is dangerous, and we are seeing. So we sort of changed the name. We took the drug and alcohol attorneys and we changed it into mental health addiction law firm, because our cases are primarily mental health driven. So I mean, there may be some substance use, but so that again has changed the way we handle these cases. You know, the guardianship statute, which was really designed for elderly people, has become a very, very powerful tool for us. We also really try to get families to work with a clinician because they need help, but we got to make sure that we get the person in the right facility. Clinically appropriate treatment is key and critical, and keeping them there long enough, because, and I tell this to families, I don't have a magic wand. There's no, I wave a wand and boom, they're better. This is typically a year-long journey to get somebody in recovery and for them to develop the skill sets, the habits that they're going to need so they can develop, so that they can maintain recovery forever. Mm-hmm. That's the goal here, right? I mean, the goal is to get it right the first time, not have somebody come back. Now, if they do, there may be some other issues as to why that happened. But the goal is to try and get them in recovery and keep them there, because the family has been destroyed. It's like a metastasizing cancer, and in the middle of it is this individual who was suffering, probably in silence, and the rest of the family is being destroyed.
Mm-hmm. So thinking about all of this, when you are doing a Baker Act, or when you are contacted about a Baker Act or a Marchman Act, you're dealing with a lot of families. Obviously, they're in crisis. They're at the end of their rope. maybe they've already spent thousands of dollars. They're coming to you probably emotionally dysregulated. And a lot of times you see families who are throwing around the use of a Baker Act or the use of a Marchman in a punishment-driven way. And it's not supposed to be that way. It's not supposed to be retaliatory, even though I hear families use it that way. How do you explain it to a family that's really in crisis, not thinking clearly, maybe because of their own mental illness or because of they're just spent?
Yeah. So I think a big part of what we do is letting the family know that we're on their side and that we're here to help them, right? And to try and make this as least an adversarial process as is possible. So, really the first part, when the family calls us, we do what's known as triaging the case. They're going to get on the phone with somebody in our intake department and spend probably a half an hour just going through all of the things that have happened. Like, what got them to this point? Why did they suddenly decide, okay, time to take legal action? And when you spend enough time, at least initially, going through all the facts, the family says, okay, hold on a second, maybe they actually care. Because my late father, who left school at 14, passed on many words of wisdom. And he used to say to me, look, nobody wants to call a lawyer. Mm-hmm. They definitely don't want to hire you, and they definitely don't want to give you any money. So if they call you, they're desperate, and you have to respect that. So we know that when families call us, it's intimidating to call a law firm. And we try not to be so lawyerly, right? Mm-hmm. I mean, I'm dressed casually today.
Just normal. I'm a normal person.
I typically don't wear a suit unless I'm going to court. Mm-hmm. Obviously, if I'm addressing a group, I might dress appropriately. But we try to make this more of a relaxing process, right? And my team is really built around the idea of caring about people. We're very mission driven. And I think once the family understands that we really care about helping them and solving the problem, everybody can take a deep breath and decompress. So, that's the first part of it. And, we make sure that we're there. I mean, we've built the firm, to be there for our clients, right? We have, you get a lawyer, there's a paralegal, there's a case manager assigned to work with you. Now, they might work on a few other cases, but we're not a high volume practice, because we know that these cases take time and we have to be there.
You have to have the bandwidth for this. These cases are exhausting.
They are, and for the first 7 years, it was just me and my wife. Mm-hmm. She only became my wife about 18 months ago.
Mm-hmm. Oh, congratulations.
Thank you. But, for the first 7 years, we did everything. We met with the clients, we did the legal work, we went to court, we did the sales, the marketing. And the last 2 years we've been able to hire, and we have built a team that is designed to really walk clients through the process. Because it's, for us, going to court is normal, right? Filing a petition, it's normal. For families, this is a very new experience, and it's frightening. And I think that, you have to make sure that they understand what's happening. You have to be there for them, and we try to be as responsive. And I really get on my team about making sure that if a client calls us, someone has to call them back, not within 2 days. They need to be called back in the next couple of hours because they're in crisis, and every call's an emergency, and every call is urgent, right? And I get it. So it's about understanding where these families are coming from. And because this is all that we're doing, and we're very mission driven, and we have a very strict set of core values, I think we could provide a good level of experience for the clients.
So here's a question that I have about this whole process. So you and I were talking before the podcast about how the rate of mental illness since COVID has just skyrocketed.
Yep.
We're seeing people who are sicker, I believe, sicker than ever before.
Agreed.
Maybe they couldn't get help during COVID. Maybe they stopped taking their medication. They couldn't get access to it. And now they're having a really hard time getting back on track. Plus, we're seeing a lot of new diagnoses just from people being socially isolated, and people just aren't bouncing back. Plus the marijuana, plus all the ketamine and everything else that we have out there. One of the things that I'm seeing, one of the specialties that I also have is in eating disorders. And I've seen the eating disorder cases, they're skyrocketing as well. So you're talking Marchman from the perspective of, mental health addiction combination. But I've seen many, many, many clients in the eating disorder realm who my thought is, why don't we have something like a Marchman for that? Is that a situation where guardianship would be appropriate?
Yeah. So, I met my wife the second year I had the practice. And so we have an office on the corner of Glaze and Federal. We still actually have it. So after a couple of months, I was able to move myself out of the library, and I got an office just a teeny tiny bit bigger than the desk that was in it. So I had enough room to walk around and sit behind it.
You upgraded a little.
Yeah, I upgraded, and my wife also had an executive suite in the same place, and we met at a networking event. And what she shared with me was, in a prior life, married to husband number one, she'd lived up in Massachusetts where his family was, and she'd done a lot of work with guardianship. And really, my wife she's brilliant. I mean, she's brilliant. And what we figured out was we could tailor the guardianship statute, which was never intended for behavioral health issues, and use it specifically in cases where there's eating disorders, severe mental illness, or we just need more control of what is a completely out of control situation, even where there's just primary substance use. And so we use the guardianship a lot. We'll use it in combination with a Marchman Act. Somebody may have been Baker Acted, and we'll go into court on a guardianship. And it is a very, very powerful tool and gives a family significant control over a situation. And so we love guardianship. And there's an emergency piece to that too. And, credit to my wife. She's just spectacular when it comes to the guardianship stuff. There's nobody that knows more about it than my wife. And, it's funny. We get calls from families who say, "Oh, I spoke to a lawyer. You can't use guardianship for this stuff." And I'm like, "Really? Really? We've been doing it successfully for 10 years and gotten spectacular results. But don't take my word for it."
Right.
And yeah, so guardianship is really great for eating disorders, because even with Marchman Act, you got to be able to prove that there's primary substance use going on here. And that has to really sort of drive in the train. And you have to be able to prove it. Sometimes mom and dad haven't seen adult child for a couple of months. Maybe mom and dad, most of the time, our parents, they're in a different state. We've had clients as far west as Hawaii, that Northeast corridor, Massachusetts, New Hampshire, New York. They're up there. Their loved one is probably down here or coming down here, or we're getting them down here. But there's been no contact for several months. So how do we know the substance use? And, even though moms typically tell me, well, I just know, and I'm sure moms do because my mom's still around, we got to be able to prove it. So it's not just triaging the case and finding out what's going on. It's also knowing what we can prove, because I'm not going to take a case that we can't prove. That's not going to happen in my office. If we can't prove it, we're not taking it. It's not because we don't care. It's because we've asked a family to take a leap of faith with us, and we're not going to ask them to do that if we can't win the case for them. Now, that doesn't mean say we can't help them. It just may mean that going to court isn't the right tool for the job right now. There's other avenues to get somebody into treatment, but maybe the legal avenue isn't quite there yet.
And I like the way you say that it's a not yet kind of thing, where it may happen, but it's just we don't have all of the boxes checked where we're able to use that tool that's in our toolbox, but we may be able to in the future. I have another question about this that I'm going to ask you when we get back from the message from our sponsor. Okay, so here's my question. We've talked about a lot of the pros of the Marchman Act, getting people into treatment who need treatment, helping the families. I've got some cons about the Marchman Act, I have to say.
Let's talk about it.
Okay, so one of the difficulties that I have, and we know this, so I'm not saying that this isn't an issue. It can take the brain quite a while to heal from an addiction, from an eating disorder. But that's very different from someone having, and I might use the legal term wrong, from someone having the capacity to make a decision for themselves. Correct?
Okay, with regards to what?
So let's say they're under the Marchman Act. They were mandated for 30 days of treatment, or maybe 60 days of treatment. They've done their treatment, and they want to go. They've completed their treatment, and they feel they're ready to go. And the family is paralyzed, thinking we can't let them go. It hasn't been long enough. They need to be in treatment for 2 years. How do you, in that situation, does the patient still have rights?
Okay, so let's talk about what at least from our perspective, what even a Marchman Act looks like. So I think, as I mentioned at the beginning, a typical court order is up to 90 days. That's what the statute provides for, and then we can go and extend it. I will tell you that when we walk the client through what it looks like working with us, we tell them this is a year-long program. And we say, we're going to get an initial court order of 90 days. We'd prefer to go 180 days and others extend it. And I will tell you that the average Marchman Act case in our office typically goes for 180 days. We typically go do at least one extension, even if we're filing for guardianship too. And then we talk to the family about what we call the continuum of care. What does that look like? Well, 12 steps. Getting a sponsor, living in a recovery residence, continuing with some type of outpatient clinical services. Because we know from experience, if you can get somebody that 1 year period, great chance they maintain recovery for the rest of their life. That doesn't mean to say that they're all done with treatment, because, I mean, I've been very blessed, over the last 10 years to make a lot of friends who are in recovery. And even if they've been in recovery 15 years, 20 years, every one of them does a meeting at least once a week. They continue to work on the recovery. It's like going to the gym. I mean, I try to get to the gym 3-4 days a week, because I know if I don't, I get out of shape. It's just part and parcel of what they do. Now, frankly, if a family comes to us and they say, well, I only want to put, this person in treatment for 30 days or 60 days, I'm probably going to tell them, sorry, don't waste your money. It's not going to work. It's not long enough. I mean, this has been going on for 5 years. How do you fix 5 years of suffering in 30 days or 60 days? And I tell them, if somebody's telling you that's going to work, we're not going to take your case, because I know it's not going to work. It's a disaster waiting to happen. And so the fact that their loved one is saying, and this is not unusual, by the way, that what you bring up, Dr. Laura, if their loved one is telling them after 30 days, I'm fine, that tells me they're definitely not fine. Because what's happened is they've been in treatment for 30 days. They probably haven't used. They may have been medically stabilized with different medications or whatever it was. And now they're feeling better. Well, of course you're feeling better. And the family's like, well, they're fine. Why do we need to continue with this? Well, because there's fine and there's lifelong recovery,
right?
Right? They're fine now because they're in treatment. They're taking their meds. They're going to group, whatever it happens to be. They're working on their recovery. But if you pull them out of the environment or you allow them to leave, they're going to relapse, and you're going to be dealing with this, and it'll come back harder and worse than it ever has before. So I get it. Families feel terribly guilty. Their loved one may be even mad at them.
We'll cut them off. I'm never going to speak to you again. So you let the families know that we're looking at least 180 days.
I tell them this is what it looks like, and you have to be realistic with people, right? I mean, you just have to.
But the patient coming into the facility doesn't know that they're going to be there for 180 days. They know
if we've done a Marchman Act, they know they're coming in for up to 90 days. Because the court has told them whether it was after a hearing and contested, or if there was some type of agreement. And sometimes there's an agreement. Not every hearing, not every Marchman Act is a knockdown, drag-out fight. They know they're going to be there for up to 90 days. That gives the facility some discretion in terms of how long and what level of care. And unfortunately, sometimes insurance is going to dictate that, which is another frustrating part of what we do. But they know, right? They're informed. It's up to 90 days. This is where you're going to treatment. And this is where we're at.
And so would it be a good idea then for, facilities, because I don't like blindsiding people. Would it be a good idea then for facilities to get on board with that idea that you're coming in for 90 days, it could be 180?
Well, so what happens, Dr. Laura, is that when we go to these hearings, they get appointed a lawyer. Whether it's a Marchman Act or guardianship, the court is going to appoint them a lawyer. So that lawyer is supposed to say, listen, this is the lay of the land. And I've done some respondent work, and listen, if I've got a client, even if I'm on the respondent side, who clearly has an issue, I'll say, listen, there's a couple of ways to handle this. We can fight this and you might lose, or we can try and resolve the case so that you feel like you got to win, but you go to treatment anyway. And I try to do the path of least resistance, because the last thing you want is to have adult-child adversarial with their parents. But at the end of the day, I mean, someone needs to go to treatment. Someone needs to go to treatment. And it's behoven on the lawyer who's representing them to at least give them some counsel as to what this looks like. Now, I will tell you from experience, the lawyers that get court appointed on these cases are really good. They're just excellent, because they're used to handling these cases, and they know how to counsel the client. So I don't think I've ever encountered a lawyer who just didn't really care enough to tell the client this is it. Most of them will say to the client, look, if there's a problem, we need to address it. So I think we're very blessed in that way, because you got to have a certain amount of compassion to even be the respondent's counsel on these cases. You can tell a client you need to go to treatment and still fight like hell for them.
Right.
But be there and say, look, I think you need to get help here, because if you don't, this is going to come back and it could get worse.
Is there a conflict of interest for the facilities, though, to push for someone to stay in treatment, knowing that they're going to, get the reward of the income? It's great for the facility to recommend 180 days. And I'm not saying that people do that, but I'm just saying, isn't that a conflict of interest to have the facility be the one to say, oh, yes, this person needs treatment for 180 days? Do they bring in someone independent? Should they? I don't know.
Yeah, I've had that. That's a great question, Dr. Laura. I've had facilities who love the MarchNet. Why? Because they know they're going to get to keep them for 90 days or even 180 days. So I think that really boils down to us making sure of who we're dealing with. So, we really work with a very less than a handful of facilities that I would send my own family to. Right now, if a family comes to us and says, I want them to go here because the insurance company has said that's where we'll pay for, and I know that facility is, sketchy, I'm going to tell the family, listen, I'm not comfortable sending them there. Mm-hmm. Let's talk about an alternative that your insurance company will pay for. A lot of time the families will come to us and they'll say, well, where should we send them to? Okay, here's a list, 2, 3, maybe 4 facilities that I'd send my own loved one to. Mm-hmm. Okay, I'll connect you with the people that we deal with so you can, learn a little bit more about who you're dealing with. And obviously, my wife and I spend a lot of time touring facilities, meeting with people that work at these facilities. And frankly, if there's anything sketchy going on, don't call me. I won't take a referral from a sketchy treatment center. I won't take referrals from sketchy interventionists or clinicians. And I've had folks like that I dealt with, and I tell them, don't ever call me again. Mm-hmm. Right? I got to put food on the table for my family. I have to be able to pay my staff, but I'm here to save this person's family. And if you're just, a shyster, mm-hmm. I don't want to talk to you. That's not what I do. Mm-hmm. And, I've had to part ways with 1 or 2 clinicians or interventionists who just simply did not care about doing the right thing. Don't call me anymore. I don't care if you blast me on social media. I'm going to do the right thing. My team's going to do the right thing because it's part of our mission and our core values. Mm-hmm. And so, are there unscrupulous facilities out there? There are. There's no question about it. They've, a lot of them are out of business now because our former state attorney, Dave Ehrenberg, did a bang-up job getting rid of all the bad actors, or most of them. Mm-hmm. But there's still some out there. Mm-hmm.
This is going to be a controversial question, but I have to just ask it.
I told you before we came on this. You can ask me anything you want. I have an open book.
What about a client's right to die? What if a client refuses treatment? I'm thinking in the eating disorder realm, but I see it in the addiction realm too, where they've been in and out of facilities. There was just a case, I believe it was in Canada, where they've been in and out of treatment their entire life, and they're just done. Leave me alone. I don't want to do it anymore. Just let me go.
Yeah, so I'll share a little bit of a personal story. So I think I told you I lost my dad. I lost him 8.5 years ago. It was 11 months after. It was 11 months after I'd opened up the business, and then my father passed. And what happened was my father had been in and out of. He'd been in and out of hospitals for like 2 years straight. I spent so much time in emergency rooms and ICUs. I almost lost track. And then one Saturday night he fell, hit his head, had a massive head bleed, and we had to rush to Delray Medical. And the neurosurgeon said to us, in order to save him, I got to drill a hole in his head. And I don't know if he'll survive the surgery. I don't know what he'll be like afterwards. And I looked at my mom and I said, he's just done. I'm not drilling a hole in my father's head. And I looked at my brother and I looked at my sister, and we agreed. Mm-hmm. And they put him on a breathing machine, and 2 days later we said goodbye. Mm-hmm. He was done. And, I'll tell you that when I opened up the practice, I said to myself, we're going to save everybody. And I remember talking to a good friend of mine who I'd only just met at the time. She's a clinician. And I said, Shell, we're going to save everybody. She said, I love your passion, but it's not realistic. You're not going to save everybody. And now fast forward 10 years, we don't save everybody. And there are sometimes we have somebody in treatment, they leave, they overdose, and they die. And that is not a fun call to get from a family. It's not. And then, or we get a family that called us, decided not to take action, then we call them 6 months later, how's things going? They died. And then there are some people who are just done. And I don't think it's realistic to say we can save everybody. It just isn't. Mm-hmm. It's no different from saying, well, if you've got cancer, we can save everybody. No, we can't save everybody with cancer. I know I'm going back to England because I lost my aunt. She had lung cancer. It killed her. It's not realistic to say that. So I think if a family's done, it's really, they call it a family disease. So I think it's really a family decision. If the family's like, we're done, we've tried everything, then I think I'm okay with that. As long as if the family's at peace. I tell families when they call us, this is a no judgment zone. And I learned this from my dad. When it comes to making important family decisions, you speak to your doctors and your lawyers and your accountant. You listen, you take advice, and then you decide what is right for your family. And and we share that with the families. Look, here's an option. There's one here and there's one here. And whatever you decide, we'll support you. Now, if you want my counsel, I'm telling you, I think that's the better option. But if you're done, you're done. That's okay. It's not for me to sit here in judgment and say, well, you're horrible people. You didn't do what you needed to do. Right. If they've been dealing with this for years and years and years, and this person is done and the family is done, then that's okay. Mm-hmm.
And I think families need to hear that. They need to hear sometimes that it's okay.
It is okay. It is okay, right? And it's not for us, me, anybody in my team to be like, oh, they're horrible people. Mm-hmm. No, they're just done. Mm-hmm. They just don't want to deal with this anymore. And that's okay. If the family's at peace with it, then that's okay.
Mm-hmm. Mm-hmm. Fascinating. So what's the best part about the work that you do?
Well, when we get somebody into recovery and we see that, the 180, right? Mm-hmm. That's the real reward. When we see somebody experience recovery and we see how the family dynamics change. I mean, that was the piece I'd been missing for so long in my legal career. So as you talked about at the beginning, I left the state attorney's office in 1999. And to be honest, I was really lost after that because I sort of lost my passion for helping people. I didn't have a mission. It took me a long time to get my life together, both personally and professionally. And when I realized that the mission was to help a lot of people, and I had somebody, a mentor that came into my life that woke me up, and I did a lot of personal growth work with him, that's the reward. Mm-hmm. I mean, obviously financially it's benefited me because I'm no longer broke.
Mm-hmm. That's always a bonus.
Well, by helping other people, I've been able to take care of my mum all these years after my father passed. So it has its rewards. But the ultimate reward is when the family calls us and they're like, yes.
They finally know they're in safe hands.
There's some peace in our life, right? They see the change over time. And I always tell families, the recovery is like the stock market. It goes up and down, right? Like a yo. There's good days, bad days, good days, bad days. And eventually the good days outnumber the bad days and the trajectory is up. But it's a roller coaster ride until we get there. And you should know that. Yeah. And understand that. And we'll cross every bridge as we get to it. We'll deal with it. But know that that's what's coming. It's not like, here's a court order, have a nice day.
Right.
You have
to be a little bit of a therapist in the work.
A little bit of a therapist, but I think when you, it's like, last year I had surgery on my arm twice. I tore my tricep over work too much in the gym. And I remember before I went into the surgery, the nurse came out and then the anesthesiologist came out and they explained to me what was going to happen. Mm-hmm. So when the anesthesiologist stuck a needle in my hand to anesthetize me, I wasn't scared. Right. He told me he was going to do that. And then he was like, count down to, you're going to start going from 10 to 1. He's like, by the time you get to, 2 or 3, you'll be out. I got to 8, I was gone.
You're gone.
I was gone by 8, right? So the point is, I think when you tell people what to expect, they're less afraid because it's not unknown anymore. I mean, do things come out of left field? Of course. Do people walk out of treatment? They do. We deal with it. Mm-hmm. But I think if the family knows that you're there for them, then you can make a difference.
Mark Astor, this has been a phenomenal conversation. Tell everybody where they can reach you.
Maybe easier to tell them where they can't reach me. So look, you can find me online. I'm all over the social media. As I told you before, I put out a video almost every day so people can get the information that they really, really need. Shouldn't have to pay a lawyer for it. So I'm on LinkedIn and Twitter and Instagram, Facebook, TikTok, Instagram, I think. Anyway, we're all over but we have 2 websites. There's mentalhealthaddictionlawfirm.com. That's mentalhealthaddictionlawfirm.com. And that really is sort of focused on helping to get people into treatment. And then thebakeractattorneys.com, which we launched during COVID when And listen, just so people know, I had a family member Baker acted, and it happened 2 days after I buried my father. So I was there. I know what that feels like. And since then, we've probably represented, I don't know, 500 people, 500 families who have been stuck. I mean, we probably have 2 or 3 Baker Act, cases pending at any one time in the office, because there's such a crazy situation here in Florida. But if you go to bakeractattorneys.com, there's just a boatload of free information. There's ebooks on both of the websites. There's video content on both of the websites. So I'm there. You'll be able to. I'm easy to find. I always tell people I'm easy to find.
Easy to find.
I can't hide from you.
Thank you so much, Mark Astor. It has been a great pleasure, and thank you everybody for tuning in to this episode of From Mayhem to Mindset with Dr. Laura. Peace out. Thanks for joining us on From Mayhem to Mindset. If you found today's episode helpful, be sure to subscribe wherever you get your podcasts and leave a 5-star review. It really helps spread the message. Want to dive deeper? Check out my book, Wisdom from the Universe, available now on Amazon. And if you're looking for a speaker to inspire and transform, I'd love to connect. Visit www.lauraellick.com to learn more. Remember, you don't have to just survive, you can thrive. See you next time.